So, hi everyone. So, let's start with one of the questions. So, this is a 25-year-old patient had an RTA and was initially conscious but later became unconscious and subsequently died. On postmortem examination, multiple petechial hemorrhage were seen in the corpus callosum. Okay, so this is a finding. A petechial hemorrhage were seen in the corpus callosum, but no significant finding were seen on the CT scan. What is the most likely the diagnosis? Subarachnoid hemorrhage, diffuse axonal injury, subdural hematoma, or the extradural hematoma. Okay, so there the answer is diffuse axonal injury. Why? Now, if you go with the other option in the subarachnoid hemorrhage, there you will find some finding in the CT scan. So what you will find here, you will find a hematoma shaped lesions in the CT scan in subarachnoid hemorrhage. In the subdural also, you will see that crescent-shaped hematoma in the CT scan. And in the epidural hematoma also, you will find the convex shaped hematoma in the epidural hematoma, and also along with your lucid interval. So in all the three, you will find some finding in the CT scan. So whenever there is an petechial hemorrhage seen in the corpus callosum, it is basically a hallmark sign of the diffuse axonal injury. What happened in the road traffic accident? So if I see in this, so in the road traffic accident RTA, it is a high velocity trauma. Okay, it is a high velocity trauma. So in the high velocity trauma, so there is a shearing. Okay, there is an it causes shearing injury. It's basically suggest shearing injury, and that shearing injury is most commonly in the corpus callosum. Okay, and in the corpus callosum you will see a multiple petechial hemorrhage. And along with this, there is an other site also, that is in the brain stem also. You can also find the same thing in the petechial hemorrhage. So such there is a shearing injury. So first there is an initial consciousness. So initial consciousness, okay, and then there is a deterioration, okay, deterioration, and afterwards unconscious, and then resulting into the death, okay, and then death. So whenever there is any question, their patient is initially is okay, initially he is conscious but later become unconscious and then died or goes into the coma. And if there is a petechial hemorrhage in the corpus callosum, your answer will be a diffuse axonal injury, and it is a hallmark of the sign, that is petechial hemorrhage in the corpus callosum. Okay, so this is all about the question. So remember, in this type of cases, CT scan will be the normal, and better diagnosis will the MRI, because it's a microscopic hemorrhage. It sometimes it cannot be seen in the CT scan. Better in the MRI. Okay, so that is the explanation of this question.